Our next speaker is Dr. Yevette Giovannetti, and she is a pediatrician in practice since 1982. She has more than 20 years of experience as a medical director of Proyecto Lacta, which is a breastfeeding clinic in Puerto Rico. She's led many initiatives in Puerto Rico, and she's been recently involved in getting some administrative orders that directing care in maternity centers. She's a clinical professor of pediatrics at the University of Puerto Rico School of Medicine, and has been very active in the AAP section on breastfeeding.
Well, I thank you all for staying so late in the afternoon and having the time to listen. So maybe I have some extra time from you just to give an aside and reality check of what's happening in Puerto Rico. But I'm happy to be here, and I feel so honored because through ABM, I've been mentored, and when I started my practice through AAP and then ABM, I really discovered a mission that has made my pediatric experience to be very fulfilling. And I wanted to share that with you. And when we ask who listens to the moms in the Puerto Rico's Hispanic community, who listens to the Latinos, what works for breastfeeding, hopefully we're all listening. But sometimes it doesn't happen that way. So we, as an aside and reality check, I wanted to just to deepen on some statistics that we have on Puerto Rico. Every 2 years, we do a survey on mother-infant care by the Department of Health, by the Maternal Child Health Division, and we study the percentage of breastfeeding in the hospital. And for the last 10 years, we've had a significant success in initiation of breastfeeding. 72% of our mothers from 50% that we had in 2002 initiate breastfeeding. But when we look at that now, and we see the reality that what has happened is that in 2012, what we're seeing is that we're not seeing exclusive breastfeeding. It's the same issue that you have all presented here that happens with the Latino. The Latino is doing mixed feedings from the hospital. In fact, we analyzed that we had even 18% only doing exclusive breastfeeding in most of the hospitals. And why was that? Because the hospitals that they were giving birth, only 21% had the opportunity to have skin-to-skin, and only 40% had rooming in. And we know those are variables that are necessary if we want to have exclusive breastfeeding from the beginning. So even though in paper in 2005, we had all the legislation in Puerto Rico, we were at the vanguard, we were forerunners. We have all legislation for moms to breastfeed successfully in the workplace. In fact, in 2006, we had legislation that the mother who's working in a company, she can have 1 hour of license of breastfeeding extraction if she's signed by the pediatrician for her first 12 months of life. If it's a small company, then she gets 30 minutes of extraction policy. We have all the laws that you're trying to implement now about lactation room in the airports and breastfeeding in public. All of those laws are in place. And we also have a law on early childhood where the mother is entitled to go through childbirth with a doula and accompaniment, and to have all these elements of having no restriction on breastfeeding since birth. We also have a law that says that no mother can be supplemented unless she signs, unless there's a medical necessity. And that law came into place in 2006. But if we don't have rooming in, and we don't have that contact skin to skin, it was very easily manipulated. The mother will sign in for the permission to supplement the formula. So we realized we have something to do. Also, as a reality check, you're going to see more Puerto Ricans in the mainland, because the Pew Charitable Foundation actually did an article just this past Monday, CNN Money, that Puerto Rico's government is bankrupt. We have a deficit of $73 billion, and our mothers who have the higher prevalence of breastfeeding in the hospital, which is the one that has 12 years of education, good prenatal care, and private insurance, they're migrating to the States. We have 48,000 people who are migrating every year to the United States. So this is an aside, but I thought it was maybe important so to explain the objective, which I was going to explain more in the psychology of the Latino and why they're doing so much big breastfeeding. So is it? No, it's next. So in our culture, and what we presented this morning too, and this afternoon, we have the framework where we want to nurture these new moms. These new moms, Latino, African American, Caucasian, they're curious, they're enthusiastic, they want what's best for their baby. Once they're educated, acculturated, and informed, they really want to do exclusive breastfeeding. And in the Latino population, we're nurture, we're spoilers, but we're past cultural tradition. It is a matriarchal society, and the mother will seek approval of her family and the persons who are following her. And this previous generation did not breastfeed exclusively. And as you had mentioned before, the issue of insufficient milk is a great problem for the Latino population. So they will, the daughter, even though she's educated and has 12 years of education and might know, might be more educated than her mother, she's a dutiful daughter. And this is a new psychological problem that they're bringing. The Hispanic, the Latino, Puerto Rican daughter, she's dutiful to her mother. She's sensitive to her mother. So she wants to please her mother. So she seeks that approval. So we need to bring in to all that prenatal education, we need to bring in the mother, the extended family that will help that mother in her parenting skills, because it's part of our tradition. When you give birth, the whole family gives birth with you, and they go to the birthing room and they applaud, and it's not sensitive. You don't have that one-to-one individual that you'd really like, but it's part of our tradition and we have to work with that. So we have a lot of challenges and opportunities on prenatal education, and there was very few of this prenatal education going around in most of the hospitals. We used to have very good federally qualified health centers, but with the problem of health reform, some of those centers have just disappeared, and a lot of the mothers are going to the private hospitals to give birth. So this availability, only 16% of the private hospitals were giving prenatal education. In the culture, the culture has strong cultural ties, tend to be respectful of the physician, so we had to get the physician on board. By 1995, we had a law that oral physicians, no matter what the specialty, they had to have 3 hours of breastfeeding education. But that was 95, and it's been 20 years have passed, and this law was derogated for CME in 2005. You no longer need to have your breastfeeding education. So we lost that, and we have new physicians, and physicians who are transferring to the United States. So we really had to go back into the education. So these OBGYN, they have to start discussing early and hook up with the weak peer counselors. That fortunately we do have a strong WIC program, and more than 70% of the mothers who give birth in Puerto Rico are WIC eligible, and the peer counselors are present in every town in the island, and they're now present in some hospitals too. So that has been a good incentive, because it's the promotora and the peer counselor that the grandmother might listen to, as well as the mother, and will help in their breastfeeding efforts. So we also need to include the doula assistants, which could be like a promotora, a friend, to give lactation support group. And you have the framework, you presented it this morning, and we've gone through that framework, and that's exactly what we have to do with the Latino population. One thing that we had to do when we realized that we had so few exclusive breastfeeding in our hospital, we had to break the status quo. We don't have any baby-friendly hospital in Puerto Rico. When the baby-friendly initiative became USA Baby-Friendly, and Puerto Rico was part of the US Baby Friendly, we have been unable to become US Baby Friendly because all the documents for physicians, for patients, everything has to be translated into English and approved, and there has been not really a cultural sensitive connection to become a baby friendly hospital in Puerto Rico. So this created a problem for us. We have to empower the childbearing women. We have to give them breastfeeding education, what we call cultural empowerment, and define the new norm for the family. We have to help establish the uniform hospital facilities patterned after the 10 steps of baby friendly. So we had to do something so that we could bring this information to our institutions that have become lax and have not been able to continue with the practices that we know could make initiation of breastfeeding successful. So we did a lot of coalition building. We do have a strong maternal child division in our Department of Health, and a strong breastfeeding committee, and we've been working there, and we've had all these policies drafted in the committee of the Department of Health, and all the laws have been passed there. So we used that system, and we revitalized the coalition building. We got a network of collaborators. Everybody became on board. We got the hospital association, we got the visiting nurses, which were very positive in Puerto Rico to help the breastfeeding practice, and we got the WIC program also to help us. And actually the Head Start population, we have Early Head Start, and the Early Head Start gave us some funding. So funding with Early Head Start and Healthy Start, the visiting nurses, we just got together and decided we have to do a Mother-Baby Summit because we have to explain to all our administrators what is really going on, and we have to make people aware. And we were using the MPINC results from Puerto Rico, which were really dismal. We were the second lowest in the nation, and even then we had very poor participation. In the 2011 MPINC, maybe less than 8 hospitals participated. So we had to make people aware. We wanted them to go through the process of answering the questions that are drafted by the maternity practices interventions in the MPINC score, so that they would be aware where they're standing and create the healthy compensation among the 3 hospitals that are private that were seeking baby friendly, but were not able to make it because of the cultural differences. So we got everybody on board, and we did a press conference. When the 2013 results, the 2014, we explained them, please fill out the MPINC. We just called the hospital administrators, 20 hospitals came in, and we showed them step by step what is the evidence-based best practice for breastfeeding, what should you do, who should answer, who should be in the hospital. So we invited administrators, the quality people from the hospital, and the nurses, the nurse supervisors. And so we were able to get better participation in the 2013 MPINC, but still we had a very low composite quality score. So we did a press conference. The person in charge of the health department with myself and Wick, we said, well, let's publish these results. And this created a havoc because you don't like to fail. And we were seeing failure rates by the Puerto Rican community. So they got really upset. Even the governor got really upset. We have to do something. Why are we failing? We also have the highest premature rate in the nation, second highest, I guess. And we also have a higher infant mortality rate. So with WIC, AAP, Maternal Child, and some help from the World Health Organization and the Pan American Health Organization, we did a meeting just this past January. We got the health insurers on board also to come to the meeting, and we invited the groups that had been successful in Puerto Rico. And we highlighted some of the projects which you have done in detail with your projects. I'm not going to do this today, we don't have any time. But we do have a Lullaby Alliance where we create a chorus and we show the mother, in order to rear her baby, how to sing the lullaby. We go through the lullaby and we do a massive chorus with mothers, fathers, everybody. We just sing the childhood songs together, and it's a practice through our breastfeeding support groups, and it has been very successful. And the local newspaper picked it up, and every week they're doing advertising on the initiative, and they always add something on breastfeeding in the end. So that's very good. And one of the projects, it's called Palante Naciendo Criando, is aligns a doula with a physician and a psychologist to help establish the mother, help her prepare and do all this cultural empowerment to try to help her winning the breastfeeding program. So there's the first program here, it's called Separe. It's a public health educator with a doula assistant, similar to the one that you have in Virginia. And what we did is we have a case manager that was just sponsored by one town in Puerto Rico. The mayor sponsored this initiative with the Department of Family because it was a town that had a lot of unemployment, a lot of school withdrawal of the adolescent, high teenage pregnancies. So the mayor put some money in that. We got a public health educator to go there, assign a case manager to the mothers, assign the doula, and in fact now we have like even a doula certificate that we give to the same mothers who go through the process to keep on doing this program. And this has been one of the most successful programs. It's called Separe, has had an 80% exclusive breastfeeding rate among their participants. Our program is from 1995, and we just have a breastfeeding education clinic, and we've done all the breastfeeding education for the health professionals, and we continue doing that, and now we're hopefully going to do it for the hospitals. There's a Kellogg Foundation small grant in a small town in the island called Muralla de Vida, and they do baby showers, a lot of parties, a lot of food, and they get the lactation consultant to sponsor them, and they're doing some very good work. And the Cinco Deditos, which is the 5 your five fingers, is the musical component, where through the music and the lullabies and teaching the mothers, we're helping with the breastfeeding promotion. And Palante and United Way has joined with the La Leche League, and they're doing a lot of town-based programs, support groups, etc., and World Breastfeeding Week programs. So basically, this governor, when he saw all of that, he said, oh, we have to do something, called the Secretary of Health. And then we went to the Secretary of Health, explained to her what baby friendly was, what we know evidence-based that we had to do to change the statistics. So an administrative order was signed that included basically all the 10 steps. In order to the hospital to be licensed, they had to follow this regulation. So we got this signed on March 2015, so it was like Island 1 legislation to try to get some baby-friendly initiatives on board. And by May 2015, they had to have implementation. So we worked 3 workshops, and we got 23 hospitals to do the workshop, and they were really happy to, and they're working. Every hospital is working, and they have their quality improvement. And I wanted to show you the last slide. Let's see. 2 slides that are missing. Okay, so we showed them what tools. We did a web page. The next slide. We created a web page called Segunda Cumbre Materno-Infantil. Cost us nothing. We use Weebly, and I mean, it's very rustic, but we put for the health professionals all the tools that are available that are free of charge in Spanish that they could use to train their health professionals. So we use the World Health Organization, the UNICEF, some baby-friendly materials, the CDC, the AAP policy. Everything is in that website, so people can read, and then they'll call back and refer to us to be able to do their own teaching education. We're planning to train the trainers, but we hope that each hospital can do some training later. So basically, breastfeeding is for all of us, and politics, legislation, and new programs are associated with positive changes. We have to implement a monitoring system because we lost the monitoring. We had all the laws, everything was in place, but somehow everything, there was no regulation that was implemented. So we're trying to do visits, and it's a punitive approach, this administrative order, because we have a hassle form that the mother can sign. It's been published what the hospital is supposed to provide, and if her rights are violated, she can write a hassle form, send it to the regulatory agency. They will get a fine up to $5,000 if the hospital is not complying with the skin-to-skin, and the mother had asked for skin-to-skin in the delivery room, and other examples like that. So basically, we know what we need is community engagement, what you all are doing, active family participation, try to understand better what is in the Latino community, the familiarism versus the individualism, and that really makes a difference for us, and so that we can support this anticipated health promotion changes. Thank you.